Hi, everyone. Thanks for joining us. I'm Dr. Davidicus Wong. I've been a family doctor in Burnaby for 30 years, but I grew up in Burnaby. So my public health talks have been part of me giving back to my own community. So today I'd like to introduce you to the Empowering Patients program. So I started it with the Burnaby division 6 years ago, and it's kind of expansion with my public health education I've been doing with my Burnaby Health Comms for the past 30 years. So what we've been doing is giving talks in the community to provide you with the information that you need to stay healthy. And it's objective information because we find that a lot of information that we get on the internet, on television, and in commercials are really trying to sell you something. We're just trying to sell you good health. So there's a website, the Burnaby Divisions of Family Practice website that we'll give to you, and it should be listed in the chat a little bit later. We'll give you how to link on and learn about our previous talks and upcoming talks, and all the resources from every talk I've given in the past 6 years are online. So you can look at the slides, and there's videos of the talks we've given in the last year, and some good videos on how to survive if you ever get admitted to the hospital, how to talk to your doctor about emotional well-being, and screening tests that you should be going for. So today I'll give you a few practical tips for staying healthy during the pandemic, but it'll just be kind of a snapshot of what you can get from looking at the Empowering Patients program. So I'm just gonna advance the slide. So the website is divisionsbc.ca Burnaby, and there you'll see some links, and I'll show you how to kind of navigate the site in a moment. So the Burnaby Division of Family Practice is a nonprofit society made up of the doctors that look after you, all the doctors that look after the patients in the Burnaby community. So we care about our patients, and you knew that already, but we also care about our community. So what is healthcare? A lot of us think about what's going on in the acute care hospital, about operations, what you see on Grey's Anatomy, but we do know that the bulk of what healthcare is what happens at home and in the community. And if you talk to family doctors and nurse practitioners, we might say that's mainly what we do, but really who provides most of your healthcare? I think most of you do know it's you. So my philosophy is that real healthcare is self-care. And the best predictor of your future health are the habits you practice today, at least those things within our control. So my goal with the program and everything I do with the public is to empower each of you to live your best life, to achieve your dreams, and to help you deal with the healthcare system and our health as it changes over a lifetime. So I conceive the 4 foundations of self-care, looking after ourselves, are what you eat, what you do, how you feel, and how you connect. I'll elaborate on each of these and kind of give you an overview of the topics of our Empowering Patients program. So the program not only encompasses healthy eating, healthy physical activity, healthy relationships, and emotional well-being, but the talks also cover the patient-doctor relationship, and how to communicate better with your healthcare provider, how to get the information you need to stay healthy. We have talks and videos on surviving your hospital stay, so how you can know what's going on and ask the right questions and make sure you have an advocate in dealing with healthcare providers. And there's some key talks on what you need to know about diabetes, what you need to know about high blood pressure, and an upcoming talk on April 21st will be what you need to know about heart disease. I believe the links will be put in the chat as well. We've given a talk on medical ethics and also the key symptoms you should be watching out for. Kind of the questions doctors will ask you if you're doing a complete physical, which of course, not too many people have had in the past year during the pandemic. When you go to the website, you'll find actually some keys on making positive changes. So once you've identified things you want to improve in your life, there'll be some really key tips on how to make those things happen. The keys to changing, transforming your undesirable habits to the habits you want to achieve to your goals. So you'll find videos, key point handouts from each of the talks, copies of some posters that are inspirational that I designed early on in the program. And I think the links to the posters are also going to be in the chat in case you want to download them and put it on your desktop too, including the 4 foundations of self-care. And all the slides from my talks are available there for you to look at and share with anyone who would also benefit from this information. When you go to the division's website, you'll see for patients. So you would click on that. You'll see the Empowering Patient resources. So you'd click on that, and then you can see any upcoming talks, including the one on the 21st. But there'll also be a link to other resources, and then you'll find actually the links to our videos, as well as the past slides and key points handouts. So please take a moment this long weekend to look at the division website, look at empowering patients, and then kind of look around to see what information would be helpful for you. And if you're interested, sign up for my next talk on the 21st. So I'll just give you a snippet of what you would expect in some of the main talks. The more recent one we did was healthy eating. Of course, we are what we eat, even if we're gingerbread people. And of course, we wouldn't put bad fuel into our vehicle. So why would we do that to our bodies? But we do that all the time. So some of the topics in the slides and the videos that you'll see would be how the diet affects your health, Canada's new food guide, which has been revised just in the past 2 years, healthy eating on a budget, because that's been a struggle during the pandemic as well, and a quick review of 3 popular diets and kind of the risks and benefits and reasons why you might want to talk to your doctor if you're thinking about going on a big change like intermittent fasting, the keto diet, or the paleo diet. And again, making positive lifestyle changes is key. Sometimes we know what to do, but it's hard to make those changes. So this is just the image of the new Canada food guide, which really emphasizes vegetables and fruits, eating protein foods that don't necessarily have to be meat products, and choosing whole grain foods and making water your drink of choice. That second foundation is what you do, physical activity and appropriate rest. So in that talk, we talk about the benefits of exercise and kind of the key aspects of physical function and how they enhance everyday living. So it's not just to make yourself an athlete, but you'll notice that if we attend to the important areas of fitness like flexibility, strength, and endurance, it helps us do everyday things like look after the yard, do our gardening, and doing our laundry. And we have practical tips on how to fit physical activity into your everyday. My philosophy is that we were made to move. When we don't, our health suffers. But when we do, we thrive. And of course, my role model is my own pop, who turned 91 this month, and he's very active and does his own lawn and maintenance. He's a low maintenance dad. I don't really have to do anything for him. I always ask if he needs help in working on projects around the home, but he's very independent. I think that's one of his keys to health, being socially connected and also physically active. Here's a few tips on fitting physical activity into each day. And it doesn't have to be going to the gym, which of course is almost impossible these days. So let's look for simple ways to increase your level of physical activity. So if you can, you should walk or even bike to school, work, or to the corner store. If you can get off the bus a few blocks further to make it to your destination. And of course, a lot of my patients like to walk, but they don't want to walk when it's raining, which is about 60% of the time in the spring, fall, and winter in Vancouver. So invest in a bright umbrella and a nice yellow orange raincoat and embrace the rain. That's a part of what life is in Vancouver. And when you're at home, you can go hands-free and walk and talk on the phone while you're doing other things and dance to your favorite music. Of course, during the pandemic, it's been hard to limit our screen time because that's our actually social connection and how a lot of us are working as well. But we should limit our time on the phone and tablet in front of the TV. My dad still likes to watch a lot of DVDs and TV, and he's always exercising while he's watching his favorite shows. And of course, Burnaby has a lot of resources. And although there might be some restrictions on our community centers, we do have wonderful parks with lots of activities that are available. And our local pools, I believe, are still open with some restrictions for the pandemic. But being outdoors, especially in the spring and summer, is a great opportunity for all of us. That third foundation is how we connect, healthy relationships. Now, we don't see too much of this now because we have to wash our hands immediately after. And it's been hard for young people because they've been away from their loved ones and their significant others. And it's been really hard for a lot of seniors that haven't been able to see their family. And hopefully after we get everyone vaccinated and get the community spread under control, we'll be able to reunite with our loved ones again. In that topic, healthy relationships, we cover why relationships matter, sources of conflict, some qualities of healthy relationships, and the keys to nurturing those relationships. I always like to think of what Ira Bjork, a palliative care physician, told us. The four things that matter most at the end of life and in life right now is we need to forgive each other, to ask for forgiveness, to say thank you, to show appreciation to our loved ones, and to also express our love. And in all relationships, we have different ways of expressing our love. So Gary Chapman wrote that book, The 5 Languages of Love, and guaranteed each couple receives and expresses their love in different ways. So we have to kind of attune to know that even though we're expressing our love and saying it to a loved one, they might want to see that in quality time together, or some people like expressions of affection, physical or material things as well. So make sure you're speaking the same language of love and express it in many ways so that the people you are close to know how much they're cared about. Emotional well-being was a big topic, and we have some videos, and the slides again are available for you to review through our website. The 3 important things to remember about this pandemic, because it's been stressful and very depressing for all of us, but especially those that have been feeling isolated in the community. You really are not alone, and that you have the strength and the support in our community to make it through this pandemic. And together, we're going to come out stronger and more connected. So you're not alone. You're part of a greater whole, part of a community. And how you're feeling is a normal response to the circumstances. And you have personal strength, but you also have the support to make it through this pandemic. So we have the ability to manage our emotions, and our talk on emotional well-being actually gives you some tips with mindfulness, meditation, cognitive therapy, and also resources of where to get help if you need it. And we can learn to expand our perspectives and see things from other people's point of view. And most importantly, there are community supports as you're learning through the seniors fair of where you can get help if you need it, emotionally, socially, financially, and getting the food that you need to stay healthy. And the big lesson is we're all better together, and we could never have gone through this pandemic without each other. So a good source to find help is through our primary care network, which is organized as Seniors Fair. And you can go to burnabykoronavirus.com or the division's website as well to access information. And there's great supports for you or anyone you know who might need some extra help in any of those areas. I really believe that we're going to come through this pandemic even stronger, more connected than before. The COVID-19 has made us separate and be physically distanced, but I think we've all come together and helped one another. And we're going to emerge with a renewed appreciation for our community and for one another and a new sense of compassion. In the emotional well-being talk, we cover how to look after ourselves, managing stress, which is inevitable. As I mentioned, we talk about meditation and where you can get some resources to learn more, how we can manage our thoughts with what we call cognitive therapy, so we don't fall into negative thinking or very anxious thinking, and learning to visualize our goals. So a few tips on managing stress, which we all experience. First of all, regain your sense of control. In psychology and medicine, we call it the locus of control, that sense of positivity, that sense of having something within your power. So first, identify the sources of stress and ask ourselves, are we reacting in proportion to that stress? And do we have all the facts that we need? And think about what you can do to change or what you can control in the situation. Accept what you can't change, but assume responsibility for what you can. And again, recognize your choices. I always like this serenity prayer because it's written from a good psychological perspective. Grant me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. So what do we know about COVID-19? We know it spreads mainly through respiratory droplets, to some extent airborne in enclosed areas. You can prevent infections by keeping your distance 6 feet or 2 meters apart, wearing a mask when you can't keep that distance, and washing your hands so you avoid droplet contact with your eyes, nose, or mouth. So we've known that from the very beginning. The other good thing is that we're all being vaccinated, and hopefully long before this year is over, the majority of people will be vaccinated. And also remember, your family doctor is available for you, that although we don't always see you in person as we used to, we're available by phone, and we're still bringing our patients into the office when they do need a physical examination. We're doing everything we can to keep everyone safe with face masks, hand hygiene, not using waiting rooms as we used to, showing patients directly into the room, keeping patients away from each other. So we have very strict safety precautions in our clinics, and your doctor is still there. You don't need to turn to people that don't know you best to get best advice on how to look after your medical problems. So the most important thing is to make sure you're still looking after those things you normally would look after in your health, and make sure you're getting important symptoms looked after, even if they're not related to COVID-19. So some everyday tips for stress management is much like a parent would tell to his kids. So be a good parent to yourself. Go out and play. Have an exercise routine, but of course, keep our distance from others unless we're wearing a mask. Don't skip your meals, so schedule regular healthy meals. This has been quite a struggle during the pandemic as we've fallen into a lot of routines eating at home. So keep a good routine and go to bed. Get enough sleep and take regular breaks. Balance your activity with your rest. And then finally, as I mentioned, don't hesitate to call your family doctor for your health needs. We're still at work, we're on the phone, or we're seeing you by video. And if we do need to see you in person, we're there for you as well. We need to express positive and negative emotions with those close to us, to share our fears, to share our anxieties and our concerns. We all need a group of friends that we can talk to. So I'm glad that all of you have been able to reach out and use the internet and use the phone and reach out to support groups that we have plenty of in Burnaby. And attend to your relationships. I think the greatest tragedy is that we go through life not knowing how much we were really loved. So don't miss an opportunity to show you care in word or deed, or just reaching out to people you care about. And we do need to think of 5 positives for every negative, because our brains naturally have a negativity bias. So things always seem to be worse than they really are, but that's how we survive, to pick up on the negative. But if you actively look for the positive in your life, then you will see more of it, and it will actually give you a sense of control and positivity in your life, so that the cup is not half full, but rather overflowing. So I begin each day with a meditation and prayer of thankfulness, grateful for all the things that I have, including those parts of the body that are working fine, which is most of them, even though we have our aches and pains. And most importantly, the person beside me when I wake up in the morning, my wife and my kids and my patients and my community and my friends. So much to be grateful for, but sometimes we can't see that when we're overwhelmed with stress. So a few tips on achieving your goals, and we elaborate this in a separate talk in the Empowering Patients. So choose wisely, choose a goal that matters to you, not one that necessarily matters to your doctor more. So, what happened, what was in line with your passion, what you want to achieve. Visualize yourself achieving that goal. So kind of reshape that sense of identity. See yourself as a more healthy, active person that looks after yourself, a more connected person that reaches out to your loved ones and your neighbors. Break down that big goal of running a marathon or the sun run to just walking more. Break it down into something that's easy to do, and then you can build upon that success.
Dr.
Writing
Wong,
down the details make a difference.
we've
Sorry,
got,
Sue?
sorry, Dr. Wong, we have 1 minute left in our presentation time.
I could do it. Thanks.
Thank you
And
for your
anticipate for roadblocks and enlist support, including your family doctor or friends. So empowering patients is all about being an agent of positive change in your own life, in your community, in the world. And remember 3 things: you're not alone, you have the strength and support to make it through, and together we'll come out stronger and more connected. Again, check out the website, and remember that healthcare is self-care, and we're here to support you. So please check out our resources and come to my next talk. Thanks so much for your time.